This is David Heaton, Public Information Officer for the Southwest Utah Public Health Department. In regards to the COVID-19 pandemic that has affected the world, the state of Utah, and southwestern Utah, where we serve as your local public health department, there's been a lot of questions regarding the nature of the pandemic, symptoms, testing, vaccinations. We hope to be a trusted resource to answer those questions for you. COVID-19 is the name for a type of coronavirus that affects humans. There are several of those that affect people, and many of the common colds that we have are actually coronaviruses. But this is one that is new enough to where we don't have immunity against it until people have actually contracted the disease or the arrival of a vaccine. COVID-19 is a respiratory virus, meaning that it passes through aerosolized or droplets when people cough, sneeze, talk, sing, or in close contact with each other, especially indoors. So it is contagious person to person. We found that most of the cases of COVID-19 in our district have come from people together in close quarters for long periods of time. So that would include workplaces among coworkers, family gatherings indoors, such as reunions, weddings, parties, that sort of thing. But outdoor locations, such as outdoor events, walking, hiking, there's really a much lower risk. No need for a mask and no need to wear a mask in a car by yourself, for instance, or when you're by yourself. The definition of a pandemic is a contagious disease that spreads easily among humans, can cause a high risk to life or to health, and also becomes global. And so COVID-19 has met the definition of that and is our latest pandemic, the first one we've had since the 2009 H1N1 pandemic. We understand people's concern that the vaccine that's been developed seemed to have happened quite quickly. It was expedited under Project Warp Speed over the past year or so. But we want to assure people that the technology with mRNA vaccines has been underway and been researched for at least a decade and was accelerated and still underwent very good safety procedures to make sure that it's safe for human use. Since the beginning of the pandemic, the Southwest Utah Public Health Department has encouraged our residents to follow the guidelines from the state, from the governor's office, and the Utah Department of Health. Currently, those would include getting vaccinated if you're eligible, which is most people right now, wearing a mask if you've got to be out in public, especially indoors, in crowded conditions where you can't socially distance, to social distance when possible, and really it's quite important now to stay home if you're having symptoms of illness. Regarding COVID-19 boosters, there are many vaccines in the past that have required a booster, especially if it's for a new disease, meaning that you've got to boost the immunity you got from the original vaccine, which may wane over time. And so now we have boosters available for the Pfizer, the Moderna, and the Johnson & Johnson shot. You can mix or match boosters now at this point. In fact, that may be even recommended in some cases. And you can go to our website at swuhealth.org/COVID to get information on boosters as far as which ones are available for you and how to register for those. People who end up being hospitalized are usually those that are having serious complications from COVID-19 that affect their breathing, consciousness, to the point where it becomes an emergency situation. There are a lot of elderly people over 65 that end up in the hospital, also people with underlying health conditions. And so again, the most effective way that we found right now to prevent being hospitalized is to get vaccinated against COVID-19. We're still in the early stages of vaccinating against COVID-19. We don't know yet what general population immunity will look like over the air, how long immunity lasts from a shot or from getting COVID-19 naturally. So people have wondered, will there be an annual COVID-19 shot like the flu? That is possible. We just don't know yet. Right now we're encouraging people to get their initial vaccines and then the booster when they're eligible. Flu season is also approaching, and so people have wondered, as we get our annual flu shot, which we get every year to prevent infection from influenza, the strains that come around, how close can we get those to a COVID shot? The Centers for Disease Control currently advise that you can get those even on the same visit if you wanted, so there's no waiting period between vaccines and COVID-19 vaccine. Many vaccines and medications can have side effects, and the COVID-19 vaccine can have side effects as well. whether it's pain and swelling at the site of the injection, which is the arm, to more severe side effects over the next week or so after getting the shot. So I got a vaccine this past March, and that night and for about a day and a half after, I had pretty severe side effects of fever, body aches, fatigue, laying in bed for a while. I had had COVID-19 actually early in the year, and they were very similar to that, not quite as bad. And after about a day and a half, they just disappeared. And so again, those are not uncommon, and what that is your body building up immunity against the real disease, and you can't actually get COVID-19 from the vaccines. The Centers for Disease Control recommends that pregnant women do get vaccinated. In fact, it can not only protect the expecting mother, but also her newborn, which can inherit the antibodies that the mom gets from getting vaccinated. People with underlying health conditions, heart conditions, lung and kidney, are also recommended to protect themselves by getting vaccinated. If anyone is concerned about or wondering if it's a good idea, they should consult their doctor or healthcare provider. To get tested for COVID-19, you can go to swuhealth.org/COVID and scroll down to the testing link to find places locally where you can get tested. There is the rapid antigen test, which can tell you within half an hour if you're positive or negative. There's a longer PCR test, which is a little more sensitive and tells you within 2 or 3 days. There's also an antibody test that you can find at some drugstores where you can find out if you have antibodies to COVID-19, if you've had the disease before. It's not 100% accurate, but sometimes that can give you an idea if you do have antibodies for the disease. We may never discover the actual origins of the COVID-19 pandemic as far as where it first started, but it's understood to likely have occurred in China. Either the theories have been anywhere from an accidental lab leak to an animal jumping to human type of a situation, maybe originating in bats. It's under investigation right now, but the most important thing to remember is that it has occurred and humans haven't really had immunity for it, and so it has spread as a novel disease and caused a lot of illness and death, including in our area. And so again, we advise people to do all they can to protect themselves from it, which includes getting vaccinated. There is no cost to get the COVID-19 vaccine. You can go to many local pharmacies, healthcare providers, and also to one of our local health departments. We have an office in each of the 5 counties. Currently we have online appointments only, but there may be a period of time where you can just come in on a walk-in basis. Again, to find out for sure, go to swuhealth.org/COVID-vaccine to either make an appointment or see where those clinics are located.